Imagine a young woman named Sarah, vibrant and full of life, suddenly finding herself adrift in a sea of unexplained symptoms. She was struggling with relentless fatigue that no amount of sleep could cure, a frustrating brain fog that clouded her thoughts, and constant chills that seemed to penetrate her very bones. Every day felt like an uphill battle. Her friends, noticing her struggle, blamed stress from work and life's daily pressures, but Sarah sensed something deeper, something more fundamental, was wrong within her body. She felt a disconnect, a disharmony she couldn't quite articulate. After a simple blood test, a routine procedure that held the key to unlocking her mystery, the answer emerged, bringing clarity to her confusing ordeal. It turned out her thyroid gland, a tiny butterfly-shaped organ nestled in the front of her neck, was the culprit. This small gland plays an outsized role in overall health. Today we're diving deep into a small but incredibly powerful gland that's often called the master regulator of your body, the thyroid. This butterfly-shaped gland is tucked away at the front of your neck, and its influence stretches way further than most people realize, affecting everything from metabolism to brain development. Picture a tiny butterfly nestled right at the front of your neck, just below the Adam's apple. The thyroid has two wings, called lobes, one on each side of your windpipe, connected by a little bridge of tissue called the isthmus. Just behind it are the parathyroid glands, which are vital for managing your body's calcium, and nearby are the recurrent laryngeal nerves that control your vocal cords. This proximity is why surgeons need to be extremely careful during thyroid surgery. What's remarkable about this little powerhouse is how early it gets going. The thyroid starts as a tiny bud at the base of the tongue in the fetus, then travels down to its final spot in the neck during the first couple of months of pregnancy, usually around weeks 4 to 8. By just week 11 of pregnancy, it's already making measurable amounts of thyroid hormone, incredibly early and absolutely critical for the baby's brain development. Without enough iodine, neither the mother nor the baby can make enough thyroid hormone, which can lead to severe impacts on brain development, including conditions like cretinism or significant mental retardation. Fortunately, in many developed countries, we have newborn screening for congenital hypothyroidism, which occurs in about 1 in 4,000 live births. Catching it early means starting hormone therapy right away to prevent these devastating complications. The hormone factory, how it all works. Iodine is the key ingredient in thyroid hormone production. You only need tiny amounts of this trace element, but it's essential. We get iodine from iodized salt, seafood, dairy products, and iodine-enriched breads. Interestingly, you can get very high concentrations from medical sources like CT scan contrast dye or the heart medication amiodarone. The minimum daily iodine intake is about 150 micrograms. Most people in the US get quite a bit more, maybe 240 to over 700 micrograms. But if your intake consistently drops below 50 micrograms a day, your thyroid simply can't make enough hormone, leading to hypothyroidism. Inside the thyroid, cells are arranged in tiny spheres called follicles, which surround a central storage area filled with a jelly-like substance called colloid. The main component of colloid is a large protein called thyroglobulin. The thyroid cells actively pull iodide from your blood and trap it. Then an important enzyme called thyroid peroxidase helps attach that iodine onto parts of the thyroglobulin protein. This process creates the two main thyroid hormones, T3, triiodothyronine, and T4, thyroxine. These hormones are stored in the colloid, ready to be released into the bloodstream when your body signals for them. T3 is the more active form, usually about 3 to 8 times more metabolically potent than T4. You can think of T4 as a prohormone or circulating reservoir that your body's tissues can convert into active T3 when and where it's needed. Only a tiny fraction of the T4 and T3 in your blood is actually free and available to work, about 0.04% of T4 and 0.4% of T3. The vast majority is bound to carrier proteins. This is why measuring free T4 and free T3 levels is often more important than total levels, especially during pregnancy or when taking medications like estrogen that increase binding proteins. The body maintains balance through an elegant system called the hypothalamic-pituitary-thyroid axis. Think of it like a thermostat and furnace system for your body's metabolism. Your hypothalamus acts as the main sensor, sending out TRH signals to your pituitary gland, which then releases TSH, thyroid-stimulating hormone. TSH tells the thyroid to produce and release T4 and T3. Here's the clever part. If hormone levels get too high, they signal back to the hypothalamus and pituitary to ease up on TRH and TSH release. If levels are too low, the opposite happens, a sophisticated negative feedback loop that relies on all three parts working correctly. When things go wrong, Hypothyroidism. Hypothyroidism, the slowdown state, is quite common, especially as people age. Some studies suggest it affects 5 to 15% of women over 65. It's defined by low free T4 with a TSH level that's typically high because the pituitary is trying harder to stimulate the thyroid. The symptoms are widespread and can include feeling cold when others aren't, relentless fatigue, brain fog, dry skin, constipation, hoarse voice, hair loss, and sometimes unexplained weight gain. Doctors might notice slowed movements, slower heart rate, delayed reflexes, yellowish skin tinge, or characteristic puffiness around the eyes. But it's not just surface symptoms. Hypothyroidism can cause low sodium levels, elevated muscle enzymes, anemia, and high cholesterol levels, particularly if TSH is significantly elevated above 10. In developed countries, the most common cause is Hashimoto's thyroiditis, an autoimmune condition where your immune system mistakenly attacks your thyroid gland. Specific TPO antibodies are present in 80 to 99% of people with Hashimoto's. Other causes include iodine deficiency globally, or previous thyroid surgery or radioactive iodine therapy. The standard treatment is levothyroxine, synthetic T4 that replaces the hormone your thyroid isn't making enough of. The goal is adjusting the dose until TSH returns to normal range. Because levothyroxine has a half-life of about 7 days, it takes roughly 5 to 6 weeks to reach steady levels, which is why doctors wait that long before retesting after dose changes. The overdrive state, hyperthyroidism. Thyrotoxicosis means your body's tissues are exposed to excess thyroid hormone. When the gland itself is overproducing, that's specifically called hyperthyroidism. The symptoms are essentially the mirror image of hypothyroidism: anxiety, weakness, tremors, palpitations, heat intolerance, increased sweating, and weight loss despite normal or increased eating. The most common cause is Graves' disease, another autoimmune condition. Instead of destroying the thyroid like Hashimoto's, the immune system makes antibodies that stimulate the TSH receptor, tricking the thyroid into constant hormone production. Graves' can uniquely cause eye problems like bulging eyes, double vision, and irritation, and sometimes skin thickening over the shins. It runs in families and affects women 5 times more often than men. Treatment for Graves' typically involves multiple approaches: beta blockers to control symptoms quickly, antithyroid medications to reduce hormone production, radioactive iodine therapy to destroy overactive cells, or surgery to remove the thyroid. Each approach has benefits and risks, with radioactive iodine and surgery often leading to lifelong hypothyroidism requiring hormone replacement. Other causes of hyperthyroidism include toxic adenomas, single hot nodules, or toxic multinodular goiter, multiple hot nodules, that work independently of TSH stimulation. Certain medications can significantly affect thyroid function. Amiodarone, used for heart rhythm problems, contains 37% iodine by weight and can cause both hypothyroidism, in 8 to 20% of patients, and hyperthyroidism, in 3% of patients, due to its massive iodine load and the Wolff-Chaikoff effect, an emergency brake that temporarily shuts down hormone production when flooded with excess iodine. Transient thyroid conditions like subacute thyroiditis involve inflammation that damages thyroid follicles, causing stored hormone to leak out. This creates a pattern: first a thyrotoxic phase from leakage, then a hypothyroid phase as the gland becomes depleted, and usually a return to normal function. Postpartum thyroiditis affects 3 to 16% of women after childbirth, often linked to TPO antibodies, with about 25 to 50% developing persistent hypothyroidism later. Critical illness and thyroid tests. Patients who are hospitalized or critically ill very often have abnormal thyroid function tests, sometimes called non-thyroidal illness syndrome. You might see low T4, variable TSH levels, and other changes that are usually appropriate adaptations the body makes to conserve energy during severe illness. The crucial takeaway is that thyroid hormone replacement is generally not indicated in these situations and could potentially be harmful. It's best to wait until recovery and then recheck if needed. Thyroid nodules. Common but usually benign. Thyroid nodules are surprisingly common. Palpable nodules are found in about 6% of adult women and 1.5% of men, but ultrasound reveals even more, potentially in 20 to 45% of adult women. The main concern is thyroid cancer, but fortunately, only about 5 to 9% of nodules are malignant. Diagnostic tools include radioactive iodine uptake scans, where hot nodules that actively take up iodine are almost always benign, while cold nodules show little uptake and could potentially be cancerous. though most are still benign. Thyroid ultrasound provides detailed anatomy and looks for suspicious features like irregular margins or microcalcifications. The most accurate diagnostic tool is fine needle aspiration, FNA, biopsy, where a thin needle guided by ultrasound takes cell samples for microscopic examination. This highly accurate procedure helps identify cancerous nodules needing surgery while allowing many people to avoid unnecessary operations. Essential blood tests. TSH is the workhorse test for thyroid function screening. Modern third-generation assays are incredibly sensitive, detecting not just overt disease but also subclinical conditions where TSH is abnormal but hormone levels remain normal. The clinical significance of these subclinical states is still being researched. Free T4 gives a clearer picture of biologically active hormone compared to total T4, which can be affected by binding proteins. Free T3 is sometimes measured, particularly when suspecting hyperthyroidism. Thyroglobulin, TG, is crucial for monitoring thyroid cancer patients after treatment. Since TG is produced exclusively by thyroid cells, levels should become undetectable after complete thyroid removal. Rising levels could indicate cancer recurrence. However, about 25% of patients have antithyroglobulin antibodies that interfere with the test, making results unreliable, so antibody testing must accompany TG measurements. Specific antibody tests help diagnose autoimmune conditions, TSH receptor antibodies, TRAB or TSI, for Graves' disease, and TPO antibodies for Hashimoto's thyroiditis. Your health awareness. The thyroid's incredibly wide influence means symptoms of imbalance can be subtle or varied, that feeling of just being off that many people experience. A deeper awareness of your body's signals, combined with the right diagnostic tools and good communication with your doc, can empower you to advocate for your health more effectively. Understanding these connections between listening to your body and having the knowledge to ask the right questions is truly powerful. This small gland orchestrates such a huge array of bodily functions, and advances in testing now allow us to understand its nuances better than ever before.